All right, well, we're going to start now, and welcome again. This is session 4 of the Aging Pal cohort, and I'd like to welcome you all, and I'm going to get us started with a little reminder. And again, if you've been on all 4 of these, this will be a little bit of a repeat, but just want to emphasize how important it is for all of us to be on the same page when it comes to what is assistive technology and who is it for. I'm not going to go into as much depth as I did in February, but just want to point out a few things. And again, these slides will be in the session for folder in the community forum for you. Again, the AT legal definition of assistive technology has been around for almost 40 years. And it's in the current rendition of the AT Act, the 21st Century AT Act, which is, there's a link to that in your slides. And I also want to point out with the legal definition of assistive technology, it means any item. And I think sometimes it gets left off whether it's acquired commercially. And that means mainstream tech. And so basically anything that is out there right now and then may or may not and will be coming in the future. And it's basically any item, piece of equipment or product system, whether acquired commercially, modified or customized, that is used to increase, maintain, or improve functional capabilities of individuals with disabilities. And AT again is defined by what it does in improving, maintaining, or increasing functional capabilities of the person versus what the device is. And I think that's really important because as you look at all these different categories of assistive technology, many of these can be in different categories. So a piece of software that provides text to speech for someone who's blind can also help someone with a learning disability by reading a book or a worksheet to them, for example. And just know that, again, the legal definition of assistive technology is inherently broad enough to include all of this technology and more, including technology, like we talked about, that has not even been invented yet. And again, who is it for? For people with disabilities, older adults, those aging into disability, caregivers, and temporary, intermittent, and people with progressive conditions, and people who do not yet identify as disabled, as I've said every session, like my dad, who has Parkinson's, and also for our support networks. And that's really all. I'm gonna pop it over to Andrea. And we also have Marty Exline and Ryan Roush with us, both from AT3. And Andrea Ruth is also our facilitator for all of these sessions. And take it away, Andrea.
Thank you. Thanks, Jeannie. Hello, everyone. Glad you're with us today. I'm going to review our objectives for this session and tell you a little bit about how this session is going to go, the flow of it. Um, I'm coming to you today from Kansas City, and I was telling Jeannie that she said I look scholarly because of the whiteboard behind me. I wish I would have brought markers so I could give you a message behind me, but I didn't do that today. So listen, we're today is an important session because we want to begin to look at and have you look at how can you create partnerships, collaborations to assist the older people in your community, in your state, in obtaining the assistive technology that they may need. And our assumption is that we all do a better job at that kind of work if we work together. So today we're going to do some brainstorming later on, have you look at your own state, at your own community, and think about how could you collaborate, who could you collaborate with to meet some of these needs of older adults. Before we get to that, we're going to reflect on the partnerships and collaborations that the AT Act programs have been reporting over the last few years. And Marty's going to do that for us and give us a sample and a look at those partnerships and collaborations. Last session, we heard from several states who have partnerships and collaborations that are active and working. And so we'll just do a quick review of some of those. Then we're also going to look at some tools for assessing your current partnerships and collaborations. There are tools out there. Ryan's going to talk to us and show us one of the, at least one of those, so that you might want to get one of those for yourself and your organization and assess how your current partnerships are going. Then we're gonna have you go into break. Well, first of all, let me say I'm gonna talk about the session 2 reports. I'm gonna go over that with you a little bit where you all, the participants here, identified particularly some needs of older adults in your communities as far as assistive technology goes. And then you identified maybe some things that your agencies need in order to meet those needs. And then we looked at what are the barriers for older adults in obtaining assistive technology. And it's that particular part of the report I'm going to spend just a little time on refreshing all of us what we said about that, because it will have a bearing on the work that we're going to ask you to do in the breakout rooms today, where we're going to have you look at what are ways you might partner newly or improve partnerships you already have, and who would you need to bring to the table. So we'll do a little brainstorming on that together. And then we're going to wrap it up with some announcements, housekeeping and announcements from Marty. There are particular questions that we're going to look at in the breakout sessions, and you'll have access to those. We'll make sure that we put them in the chat. We're going to ask someone in each breakout room to be a facilitator and someone to be a scribe and someone to be a timekeeper so that we keep things moving in those breakout rooms. So be thinking about what role you might want to play in your breakout room. With that, I wanted to cover a couple of things that we said that we would talk about this session.
Did you want me to do the poll first, Andrea?
Oh, yes. Oh, I'm sorry, Jeannie. Go
No,
ahead.
no,
Do
that's
the
all
poll
right.
first. Yeah.
Okay.
We're going to have a little poll here.
Can you all see the poll?
I can see the poll. Can
Not getting
people, oh,
big.
there you go. Now you're getting your answers. Yeah, if everyone would fill out the poll, these really help us know who's participating, where you're from, whether you're with an AT program or a different kind of aging service provider or organization.
I'm going to give it 1 more minute. So if you're hesitating, you have 1 minute left. Get out the old watch here. Well, that kind of boosted it a little bit there, didn't it? Okay, I lied. We're done.
Okay. Very good. Very good. So thank
Okay,
you everyone for completing the poll for us.
thank you.
And Marty will remind us, but we'll have a post-session poll also. Okay, so I wanted to do a couple of things that we wanted to address that's feedback that we got from some of you over the last two sessions. So one is regarding our language and how we need to be sensitive to and thinking about and conscious of how we talk about older adults and older Americans in the context of this conversation. So as part of the feedback pointed out, we're all aging. So we might want to adopt the word we instead of they when we're talking about people getting older, because we are all getting older. And it helps, bridge the gap between those we're serving and ourselves. So maybe the word we could consider taking that on. We also received some feedback about making sure we don't adopt stereotypes about older adults. Um, Particularly in this arena, sometimes folks will assume that all older adults are afraid of technology, afraid of computer technology, don't know how to use it, etc. And we know that's not true. We know it's not accurate. There are a lot of older people who are using technology today very well and very proficiently. So we just want to be careful and sensitive to adopting that quick, oh, everyone's afraid of technology after they're, 60 years old. Well, probably not. Not even 80. I've got an 87-year-old mom. She's pretty handy with that phone. So we all want to just keep that in mind. And then finally, the term healthy aging. And this is one I hadn't thought about, and so I appreciate you all bringing it to our attention. So it is very normal. Human beings will probably have some disability as we grow older. And if we think about how we use the term healthy aging, we don't want to make it sound like there's a way to age without experiencing some kind of disability or some kind of loss of function or a need for assistive technology. It is very normal as we age as human beings. It's a normal aspect of aging that we will acquire some kind of disability over time. So let's not make it bad by saying, "Oh, there's healthy aging." Uh, we can watch our language on things like that, and we appreciate your feedback, pointing those things out, because we all who work in this arena need to be thinking about how we talk. Are we making it more difficult for people to come and ask for assistance with our agencies? I also wanted to address comment we got after session two relating to, or two or three, relating to aging in place. So in the context of the conversations here with the Aging Pal, the learning community that you're all part of, we want to note that when we're talking about aging in place, the ability to age in place, the surrounding people with the things they need, the assistive technology, the support to stay home, to live at home, wherever that may be, rather than being placed in an institution or having to go perhaps to a skilled nursing facility or something like that. We're we're seeing that as any age group, right? There, any age, any person of any age might end up needing assistance to the point of going to an institution or a facility. And if we, the global we, the people involved in this conversation, can assist that person with assistive technology, with services, with support in such a way that that person gets to stay at home and age there, we would like to do that. That's a goal of, I think, that we all share. So, in the context of the aging pal, is there an age for aging in place that we're talking about? Well, that depends on the aging services group that you might be partnering with. So some aging services groups have a defined population that they have the funding to work with, that they have the programs to work with. And if you're, for instance, an assistive technology office working with that group, then you might be looking at a specific age group. But for purposes of just general conversation, when we talk about helping people age in place, we mean throughout the lifespan. Okay, so hopefully that clarifies that a little bit for folks and just to, appreciate that you all bring these things up for us to take a look at together. Okay, so I think, Marty, I'm going to turn this over to you now so that you can review those partnerships and collaborations, which is really the theme of today's work.
Right. Second here. Oops, let's see. Oh, go ahead, Ryan. Sorry. There we
Marty,
go.
is that good right there?
That's good right there. Thank you.
Okay.
Um, so one of the things we wanted to talk about was, we talked about this a little bit about why the partnerships matter, and Andrea just mentioned uh, aging in place. Obviously. And there's a lot of programs that are involved in some way with fall prevention and home safety. Um, we talked last week when Connecticut talked about their Bridging the Digital Divide program that provided devices and hotspots and technology training to support social connections. Caregiver support. Missouri talked a little bit about their partnership with between the AT program and their Department of Aging for caregivers. Access to durable medical equipment, not just durable medical equipment, but also everything from medication reminders to different kinds of amplifiers to other assistive technology needed by folks with disabilities. Digital inclusion, there's several programs that are working with their aging units on cognitive health and dementia supports. So go ahead, Ryan, and go to the next. So AT programs have relationships with all sorts of different units within the state as far as their state departments of aging. There's a number of states, of course, that have combined their departments of aging and DD systems, so departments of aging and disability services. Um, no wrong door systems. Virginia has a great relationship with their no wrong door system. State Medicaid programs. A lot of programs are working with their definitions and their waiver programs of different kinds of assistive technology to make sure that needs are met by people that are eligible for those programs. Um, State plans on aging. There's a number of programs that have been involved with making sure, working with their state's departments of aging to make sure that assistive technology is part of their state plans on aging. And then advisory boards, committees. Um, and I'll go over some of these other examples in some of the next slides. Go ahead and jump, Ryan. Some of the partnerships are with the area agencies on aging, specifically between the AT programs and the area agencies. And just examples of activities, some programs, and I mentioned Idaho here, but there are other programs also. That's just an example that actually have their some loan libraries for equipment to be able to, people to be able to borrow equipment for a few weeks to try out to see if it works for them. So there's a number of programs that have lending libraries located at area agencies on aging. Iowa created a kind of a demonstration backpack with some assistive technology for staff home visits from area agency personnel. Um, Ongoing trainings for area agency staff. You know, there's two examples there, but there's an awful lot of cross training that go on between assistive technology programs in states and territories and AAA staff. And certainly presentations at meetings, long-term loan agreements. There's a number of states that have long-term agreements where individuals can borrow equipment for as long as they need it. Um, and of course, the impact is kind of all over the place as far as actually expanding AT use and the reach into local communities, um, improving referral pathways, making those relationships a little bit more formal, and um, and just embedding AT, making sure that AT is part of routine aging services, that the other services that somebody might be getting to make sure that they also learn about assistive technology and learn about what's available. Go ahead, Ryan. Outreach and public awareness. Certainly, you know, and we're going to talk about this more next month, but certainly part of um, somebody being able to get their hands on the assistive technology they need is to be aware of it and to know what exists out there. So programs are involved in all sorts of things, from going to senior fairs to working with senior centers, going into senior centers and doing demonstrations. A lot of state aging conferences that assistive technology programs are part of, workshops, smartphone and smart home workshops, or being part of workshops, including assistive technology. And there's all sorts of focus areas. I mean, vision and hearing supports, smart home technologies. There's any number of assistive technology that will help with fall prevention and just everyday living devices. Go ahead, Ryan. Almost every assistive technology program has device demonstration programs, they have device loan programs, and they have assistive technology or durable medical equipment reuse programs. It varies from a lot of the loan programs are short-term loans where somebody can borrow a device for up to 6 weeks or so. And then some are open-ended uh, longer term loans, again, that somebody can utilize for as long as it's needed. Um, Illinois has an incredible long-term device program for adults that are 60 and over. Pretty much any type of assistive technology, they receive about, I think, $2.5 million through their state aging department. Serves an awful lot of people. Um, Reutilization programs tied to area agencies on aging. Oklahoma has a reuse program. They work with their state Medicaid program, as does Kansas, with a DME reutilization program to get people the DME that they need. Demo kits. Virginia and a number of other programs have created some demonstration kits for different purposes. For example, Virginia has created separate kits, one for emergency preparedness, one for fall prevention, and another one for cognitive health. And like I said, there's another number of other programs that have put together demonstration kits for people both to, mostly for public information to let people, area agencies or other aging entities demonstrate to consumers that might be interested or caregivers. And then lending libraries. I think I mentioned lending libraries that are hosted in area agencies on aging. So I think as far as impact, you think about loan programs or reuse programs gives people more immediate access to needed equipment, maybe than waiting through another funding source. Certainly cost savings and um, aging in place, obviously prevention of institutionalization is a big goal for some of the programs. Go ahead, Ryan. Digital inclusion and reducing social isolation. That is a major thing across states. Tablet distribution. A lot of states have tablet distribution programs where people can either borrow equipment or get tablets with a variety of different apps on them. Um, Connecticut, I mentioned, they talked about in their presentation, they have uh, through their uh, connection, Bridging the Digital Divide program, and that was actually through their Rural Health Transformation Grant that they got. They'll be able to provide services through 2030. And there's a number of social isolation pilots. Um, Michigan has a program that they are implementing in rural areas through the Health Foundation in Michigan. Um, Rhode Island had a cyber sensors smart home workshop. And then just integration of digital tools into case management systems too. So you talked about social isolation and inclusion. You're talking about connectivity, access to telehealth, communication, and just confidence in the technology. And the next slide. So yeah, home modifications and safety initiatives, that's a big part of some of the partnerships that are going on. North Dakota has their senior safety program where they provide just a variety of different devices to help people be more safe and secure in their homes. Um, Delaware and a couple of other states have a pilot home modification program. Um, North Carolina, Virginia, other AT programs work on making presentations about fall prevention, um, smart home and safety education. Again, it kind of fits into the public awareness aspect of aging, not only I think for the public, for individuals who are aging, but also for uh, organizations that serve them. Um, so jump to the next slide. And then there's a number of states and aging entities that are working on partnerships in the area of dementia, cognitive health, and caregiver support. Missouri, in their presentation, talked about the state's caregiver programs for Alzheimer's families. And one aspect of that is Missouri Assistive Technology is working with providing AT to help caregivers who have family residents who may have Alzheimer's or other types of cognitive issues. Virginia is developing a cognitive health AT kit to distribute again to, I think, area agencies and to other entities. Um, and there are several programs. Michigan is working with their developmental disabilities organizations on community learning initiatives um, and trying to embed AT. Several states are really working to embed AT into dementia services to make sure that people are aware of what AT is available for caregivers and for individuals who have some cognitive issues. And again, it's not just for the individuals to support caregivers, certainly enhances safety, can reduce stress, and promotes longer independence. And jump to the next slide. So I'm going to go ahead and kind of turn this over to back over to Andrea. And Andrea, you kind of wanted to talk about some of the themes in our session 2 report.
I think first we were going to take a couple of questions or comments about what you just laid out, Marty, see if anybody has any specific things they wanted to add to the list. And then we're going to go to Ryan to give us that tool for assessing partnerships. And then we'll go back to the report. So anyone have any questions? I don't know, Jeannie, if we can take people off mute or should we have them put their questions in the Q&A or chat? Very interested in hearing from you about what's going on in your state if it wasn't mentioned in what Marty reported. We're looking for collaborations, we're looking for partnerships. There may be some new things that have happened just while this aging pal has been meeting. So we're looking for your input at this point. Let's
I
see, I
can
see
I
you.
can allow them to talk. There is a
We
button for that.
cannot, we cannot
I
allow.
can,
Oh,
I
you
can.
can. That would
Yes.
be great.
Yeah, they just
And
just have them raise their hand and I'll
yeah,
push the
that would
button.
be wonderful. If you'll raise your hand, your electronic hand. We do have one thing in the chat about Christina says, I'm not sure if this will be listed later, but we need to add Center for Independent Living, the Centers for Independent Living to the list of collaborations. Absolutely.
Yeah, and that's absolutely true. There's a great collaborations between the AT programs and Centers for Independent Living. And of course, centers are often very involved with uh, providing a site for demonstration centers for AT programs. And so, yeah, that's definitely something that needs to be added.
Yeah, and in my experience, personal experience, the Centers for Independent Living are often so connected to resources for older adults. So they know who to talk with about, having someone apply for Medicaid if that's going to help them get assistance. And they know about the offices for assistive technology. The centers are a great resource in your state if you haven't been connected with them. Thank you, Christina. Any other questions? I cannot see everyone to see if their hands raised, Jeannie, so I don't know if you can or not.
I am checking.
Okay. We're learning a new version of Zoom in case you're wondering, so bear with us. Okay, we have another chat while you're checking. Chat comment. New Hampshire has partners who refurbish and reuse durable medical equipment for long-term loans, and New Hampshire also has a partnership with the Center for Independent Living there, who refurbishes and sells the DME at a discount. So that's fabulous. And Renee put in the chat, I found the center to be full of information for older adults dealing with cognitive decline and gave us a website for, it looks like the Wolf Innovations, maybe. But if you're interested in that, she put the chat, the link to
Link.
that website in the chat. Oh, Scout has a question. Hello, Scout. Can we, there you go. It looks like you're going to be able to come off mute. Yay.
Yeah, yeah, I would put it in the chat, but I'm driving. I just David brought it up last time, but the 3D printing I think is a great option for collaboration.
Definitely. And remind us, you're from Missouri, remind us who is involved in that collaboration on 3D printing.
The AAAs and our office, the
Great.
area agencies on aging.
Wonderful. Thank you. Okay, we also have, thanks, Scout, and be careful driving, please. We got another chat comment. Oh, the Innovation Center for Cognitive Decline and Alzheimer's in Cedar Rapids, Iowa. And then also, Christina says here in Georgia, we also have a partner in FODAC that does the durable medical equipment refurbishing. They send that DME all across the state, and I believe into other states as well. That's interesting. Maybe some of your, go
I
ahead,
was
Marty.
just gonna say FODAC works with FEMA to when there's a disaster. A lot of times FODAC's able to work to get well, for instance, Hawaii had the flooding recently, and they were able to help get some tablets and also some wheelchairs to Hawaii to help people that lost their assistive technology in flooding. So yeah, definitely.
Wow, so I do not know who FODAC is. Can you, Marty, can you elaborate? Is that a federal agency? Who's FODAC?
No, they're a nonprofit
Okay.
that it works with. They're actually a partner with the Georgia Assistive Technology Program.
Uh-huh.
So
But they
yeah,
serve other states too in conjunction with FEMA at least, which is
yeah,
nice.
in conjunction with emergency situations, hurricanes, tornadoes, flooding.
Great. Great. Thank you for that one too. That's important resource there in the chat. Okay. Any other questions before we move on? I'm curious. I'm I don't know about all of you, but I have several aging folks and several people in my family who are aging into their 80s and 90s right now. And as I listened to Marty describe the partnerships and also from last session listening to the states who presented, I'm wondering if you're on this call, on this webinar, think about the people in your life who are moving into those senior years. And it just may be that something that was mentioned in the review that Marty just did could be helpful for your family member in your state. I'd love to hear if somebody thought, oh my gosh, my aunt needs to know about X. Or for me, I have sent people in my family to the Centers for Independent Living as a starting place sometimes when they were beginning to lose some of that functioning, especially of hearing and sight. So anything that piqued your interest, we'd like to hear that in the chat too. If something caught your interest on a personal level for somebody you know, or some collaboration that was mentioned sounded like something we need to do that in our state for our families. These are the things we're looking for. So if anything like that, please do put it in the chat. Okay, and I am Jeannie, unless you see any other hands raised, I don't. So we're gonna move on, and
Good to
Ryan
go.
is, okay, thank you, Jeannie. Ryan's going to review with us the um, the partnership collaboration assessment tool. I hope that you're all gonna be as intrigued by this as I am because you know we all have a sense of what partners we have, what partners we should have and don't yet. But let's see a real tool for how to assess that. So Ryan, with that, I'll let you take it away.
Awesome. Well, good afternoon, everyone. Today, I want to introduce something that I think is going to be a really useful tool for us as we think about how we grow our work and the partnerships that support that. Before I jump into the framework itself, though, I want to take a step back and talk about why we use frameworks at all. Complex problems like building and sustaining meaningful partnerships or collaborations can easily start to feel like you're trying to solve a puzzle with no picture on the box. There are a lot of moving pieces, a lot of people with different perspectives, and it's easy to lose track of where you are or where you're going. Therefore, a good framework gives you that picture. It helps you organize your thinking, break complexity into manageable pieces, and move from feeling overwhelmed to having a clear sense of where we start. And just as importantly, frameworks give us a shared language. When everyone at the table is working from the same words and the same map, conversations become clearer, more productive, and honestly, a lot less stressful. That last point about communication is really at the heart of why I wanted to bring this particular framework to this group. The framework I want to share with you is called the Strategic Partnering Framework, developed by the CDC, the Centers for Disease Control and Prevention. And I put that in the chat to where it is located. There are two files I want to point out. One is the actual framework, which is an Excel file, and the other one is the guidelines. Now, I know what you may be thinking about the CDC and everything, and that it's not we are in aging services and not necessarily working in the public health. Maybe you sometimes might go into the public health, but I want you to think about this as from the standpoint of this is to help partnerships. And so this framework is really about how organizations work together. And that is absolutely relevant to what we're attempting to do here. At its core, this framework walks you through 4 phases of partnership. The organizational assessment, that's your self-assessment. The partner selection, partnership building, and maintenance and evaluation. It's designed to be used from the very beginning, even before you've identified a partner, all the way through to evaluating whether the partnership is still working. And here's what I really love about it. It has a built-in feedback loop, meaning you can return to any phase at any time and or work at any phase at any time. So it's not just a one and done checklist, it's a process. The framework also looks at partnerships from both sides of the table, what your organization brings, but also what a potential partner brings and what you build together in the middle. That 3-way view is really powerful because it keeps us from only seeing things through our own lens. So now, as I said, our projects aren't centered on public health outcomes, but the challenges this framework was designed to address are universal. How do we know if we truly really are ready to partner, or how do we choose the right partners? How do we make sure roles and expectations are clear so things don't fall apart in 6 months from now? These are questions every one of us has either wrestled with or will wrestle with in the future. So as we explore this framework together, I encourage you to think of it less as a public health tool and more as a partnership readiness tool, one we can adapt to fit the realities of our work in the aging services and in the assistive technology world. So I want to spend a moment on something that I think is one of the most underrated benefits of using frameworks like this, and that's what it does for communication. When you're navigating a partnership, especially a new one, there are conversations that can feel awkward or risky to initiate. What exactly are you bringing to this, or who's accountable for what? What happens if things aren't working? Those conversations are necessary, but without a structure, they can often feel confrontational or presumptuous. This framework gives you permission to have those conversations and a roadmap for how to have them. When you can say, let's walk through the partner selection criteria together as part of how we build this partnership, can we talk about roles and conflict resolution? It reframes what might feel like a difficult conversation into a normal and expected part of the process. And so today, my goal is to walk us through the framework together and talk about where it aligns with our work. And so I'm going to share my screen here. Just give me one moment. And I really love this. This is and I'll describe the picture that is showing. This is from the guidelines document. This is the PDF. And as you can see, it was developed through the Department of Health and Human Service, Centers for Disease Control and Prevention. This may be very familiar for some of you AT Act programs, as we use this in the Education Peer Action Learning Group. But I still think this is highly relevant for as we think through in the aging perspective. And so this is the conceptual framework. On the left side is your organization. On the right side is going to be the potential partner. It is a top to bottom work, but as I mentioned back, there is a maintenance and evaluation feedback loop where you can revisit certain parts of the process. So from the top, there's the organization assessment, which is your self-evaluation. You're looking at your goals, priorities, mission, readiness, skills, leadership. This is kind of asking yourself, what does my staff look like? What outputs can we provide, or what resources can we share, or what absolute resources do we need? From there, you'll drop down into the partner selection. And that is kind of where you're kind of filling out the partners and potential partners. You're also thinking about what are success factors, what are going to make this successful. And as I mentioned, that first one is communication is a huge piece. And I think this really helps get you going around that communicating back and forth with each other and with your partners. In the middle part is the partnership activities. That's where you're going to talk and discuss with your potential partners together. And so you might be discussing in the partner selection is, resources, money. I know funding is a big one, and it's one that we all kind of want to steer clear of, and it can be difficult to talk about. Time, staff, skills, expertise, other resources, and so on. So from there, you move, once you've kind of identified a partner to work with, you'll go into that partnership building. Again, what commitment of staff and resources are available, individual roles, establishing those. Then you're working in that middle section where you're coming together and discussing, hey, these are the expectations of our staff and so on. This is how we're going to maintain accountability. How are we dividing the labor, or how are we going to communicate? When are we going to communicate? And sharing those timelines of when do we expect to have these activities completed by, and so on. And if there are conflicts, like say, this is one that we experience a lot, is staff turnover or people coming and going. And so it's figuring out some of those resolution. How do we resolve or adapt, and so on. And then lastly, defining the short-term outcomes as well as the long-term and objectives and the products that we may create out of this partnership. And then lastly, that's that maintenance and evaluation. So you get into the partnership you're carrying out, and over time, it's that evaluation feedback loop. So maybe you're going back to the very beginning. Maybe you need to start all over. And but you can go to any one of those steps from organization assessment to partner selection to partnership building. And so this is a document that can help, yeah, I feel like really start those conversations and understanding of each other as organizations, as entities. This works at state, local, and national level. So the I want to again address is that this is in our AT community. I provided a link to that in the chat. And the second document is an Excel file, which is a fillable file. So you can go in and add your, your information and thoughts and things of that nature. So it is intended to be filled out by both organizations, by your organization or entity, as well as potential partner. And with that, I will stop my share and open it up for any quick questions. Yeah, please put those in the chat.
Ryan, while they're doing that, could you show that again and make it just a little larger? Is there a way to
Yeah,
make it it was a little hard to read. My eyesight's probably not as great as it used to be.
yeah. So I initially wanted to show you that it's a
Whole thing.
yeah, the whole thing top to bottom, but I can yeah,
Mhm.
I can go now into putting
Oh
it
yeah.
larger here and again go kind of top to bottom. So starting at the top again, that first step or first phase is the organization assessment, and I'm reading from the left. And then underneath that is the partnership selection. From left to right, it's your organization. Middle is partnership activities. And then on the right hand side is the potential partners. Very similar. The left and right are going to be are very identical almost in a sense. As far as each other will be identifying their own goals, priorities, mission, readiness, skills, and leadership. And then in the middle part is where you guys are coming together, having those discussions, forming vision, forming potentially addressing a need, addressing a problem, an issue, kind of figuring out kind of what those pieces are going to be, and then creating those activities and or projects and or products. It could be just, hey, we're going to create this pamphlet to address, hearing difficulties or, Parkinson's or so forth. But yeah, and then lastly, diving down into the after partnership selection is partnership building. That is kind of where the activity, product, or idea or solution takes place and takes hold. And so that's where you're again coming together and defining those roles and expectations, who's going to be accountable for carrying the activities out, and so on. And then lastly, the last is the maintenance and evaluation. Does that help?
Right. Yeah, I am fascinated by this tool. It strikes me as a um, one of those things where some people naturally do a lot of those steps in forming a partnership or collaboration,
Yeah.
but maybe don't articulate each one. And like you said, the having those elements there and knowing that you're going to go through that with your potential partner and discuss each of those things makes it easier to have conversations about division of labor, who's bringing funding to the table, how much, et cetera. It looks like a great tool to me. So I have a question for our
Yeah.
participants. Has anyone used this tool yet? Some of you may have been involved in the Education PAL and had been exposed to this already, or you may have used it in a different setting. But if any one of our participants has used this and you have anything you could share with us about it, did it work? Was it tough? Did your partner want to use it? Those kinds of things. Please go down to the bottom of your screen where it says React, and I think that you can raise your hand, electronic hand here someplace. Maybe it's on. I'm not seeing that. Usually it's on React.
It might be in the more. You press the three dots and there's
Oh,
the
here it
raise
is.
hand.
It is on React. If you click on React where the little heart is, not the arrow next to it, but the heart, then you'll get all the different icons for reacting, and one of them is to raise your electronic hand. So if you could raise your electronic hand if you've used this, we would love to hear from you. Anyone?
And you brought up a great point, is that a lot of us may be doing this already, but the thing that I think about is one is going back to the basics and the foundation, and this tool helps you kind of go to that.
Yes.
But also when you're thinking about I know so many partnerships and collaborations that I've worked with in the past is so informal, and so we never got a statement of work or a memorandum of understanding, but this tool can kind of help, even if it's informally, it kind of gives us a little bit of definition, and so I appreciate this tool in that sense.
Yes, and also could help you avoid communication issues or misunderstandings in the future because you actually have gone through those conversations on the front end.
Yeah.
So yeah, I love it. All right, I'm seeing wow, 45 people on, and I don't think anybody's used this tool. Well, now you have a new tool, everybody. Thank you, Ryan, for going
Yep.
through that. Appreciate
Yeah.
it. Okay, next I'm going to take a few minutes to go over some of the themes that came out from your work in session 2, those of you who were with us. If you'll remember, in session 2, we really wanted to have you all look at three questions that we thought were important for us to look at together. One of those was, what are the AT needs of older adults in your community or your state? Then we also looked at I'm going to get the exact wording. What do aging services organizations and AT Act programs need to help older adults obtain assistive technology? And then finally, the third question, which is mostly what I'm going to focus on today, is what are the barriers for older adults in your communities in obtaining assistive technology? So, Ryan, are you going to go through my slide or put my slides up, or is that already you?
Yes.
Thank you. Thank you. So just so you'll know how I put this together, I took the Padlets that you all worked through when you were in your breakout groups in session 2, and I tried to pull themes out from the responses to the questions. Some responses, some ideas that you put on the Padlet actually fit within a couple of themes. So you may see, when you look at the full report, you may see things in 2 or 3 places. But the idea was to try to take a lot of data and put it in some chunks that we could actually discuss and look at. So the first question, what are the AT needs of older adults in your community or your state? We gave you the first one on the Padlet. We gave you a little cheater that fall prevention would be one of those topics or one of those types of needs. And I added to that alerting systems because that showed up in a lot of responses that you all gave us, that things like motion activated lighting and LED lights on the floor and things like that were things that you mentioned, personal emergency response systems that you mentioned were important AT needs for people in your older people in your area. We also talked about, and you all talked about, assistance with healthcare, and that's things like the affordable wearable smartwatches, where people, are able to look at their own health indicators in real time. Those are wonderful assistive technology pieces, and a lot of people do need them as we age. You all talked about medication management, things like, and this comes up a lot with people I know, transportation needs to get to medical appointments. In some areas of our country, that is a huge need, and especially for people who have some disability. So transportation, you're going to see as a thread throughout this report from session 2. We also you talked about communication tools, phone communication aids for people with hearing loss, things like I learned something new from you all. I did not know what talking medical caps are, but this ended up on the communication tools list, and talking medical caps, if I understand them, are caps that people, for instance, in a surgery in an operating room would be wearing. The nurse, the doctor, the technicians would have these caps that would identify who they are and what their role is, so that if you are someone who's disabled and you're going in for surgery, you have several different ways of finding out who that person is in front of you. I love that. Talked about also in that category things like communication tablets for people who are nonverbal, to help them communicate their needs and their feelings. Then computer technology was also listed on this one. Computer technology, as we know, a huge one. Needs around that are things like telehealth connections, iPads, digital skills to use those devices. The wearables came up again, things like smartwatches, shoes with built-in GPS trackers. I love that one. So again, computer technology is one need that you all are seeing in your geographic areas. And then home accessibility and modifications, of course, things like smart lighting, kitchen access, adaptive kitchen tools for individuals with poor grip, home modifications in general, smart stoves and ovens, certainly ramps and safety rails, stair lifts, that kind of thing. And then home safety. Visual alarms came up. Again, the smart ovens and stoves that turn off when you walk away. Wonderful technology that's available for people, but some folks in our service areas need these things. Remote monitoring, using technology to stay safe in your home, like Ring cameras and that sort of thing, alarms. Then you all mentioned a lot of things that fall into the category of isolation prevention. One of the key ones was connecting with family members regularly. And how do people with disabilities or who are aging with some hearing loss or visual impairment, how do they stay in communication with their family members? Software and technology to promote social connections, addressing social isolation and fostering connection with community was mentioned. Fraud, if you'll go on, Ryan, to the next slide, this is a continuation of answers to themes to the question number one. So lots of awareness needed around fraud prevention, security and privacy needs, how to safely use the tools that people have access to. Then vision assistance. I put all these together in this slide, but vision, there were several mentioned around vision assistance, several mentioned around hearing, and several around mobility assistance. So I just hit on a few of them. Things like scanners for shopping help the visually impaired. Assistance with vision decline, so glasses, whatever the assistive technology might be, magnifiers, talking devices. And then as far as hearing assistance goes, those visual alarms came up again, hearing and vision enhancements, hearing aids and how to use them appropriately, phones for people who have hearing loss that write out what is said. I'm seeing those advertised on TV a lot now. And then mobility assistance, the needs that you saw there, things about motorized lift chairs, arthritis and frailty modified tools, accessible and affordable durable medical equipment. Assistance with things like recliners. Apparently, recliners is coming up a lot for people as a need. Then memory assistance, the next category, the next theme, included those shoes with the built-in GPS trackers, which I think is an amazing tool. Assistance with technology decline, devices that remind people to take their medication or do the everyday tasks like take the dog out, feed the cat. I know that there are a lot of tools available now that remind people about their medication and that have different ways of measuring out the dose, et cetera. So that was there with memory assistance. And then transportation assistance, huge issue, huge need. I'm not going to go into that here anymore, but you know what they are in your community. Recreational assistance. I had never heard that term. I don't know about you, but things like adaptive gardening tools, gaming aids, different assistive technology that help people with their social connections, help them connect with people. Information and referral was a theme throughout these needs, that people just need more awareness of AT, how to find it, education about it, and where do they go? Where do they go to get that? They don't know. And then miscellaneous, I just had to have a miscellaneous category for some of these comments that you all put on your report. So caregiver technical support. We need good internet access and connectivity. We need low tech items. And this gets to our comment from Missouri a while ago about the printing, the 3D printing. People need low tech items like bottle openers and nail clippers and ways to open packaging and that sort of thing. Arthritis and frailty modified tools. older adult friendly infrastructure, communication support, options that are low tech and options that are high tech. Digital skills, I think we talked about that. AT to offload, support, somehow cognition, right? Now, I want to go on to the next question, which was question 2. What do aging services, organizations, and ATAC programs need to help older adults obtain this assistive technology? I'm not going to go through each one of these because I want us to keep on time here, but as you can see, you all identified a lot of needs that your agencies need. And if you read the report and get to the detail, I think you will see that these themes capture most of the things that you put. Public policy and funding, of course, big one. Ways to deal with the digital divide and expand our resources, reach caregivers, etc. So let's go to the next slide. And this is where I really wanted to spend a little bit of time before you go into breakouts. So what are the barriers? You all identified the barriers that older adults have in obtaining assistive technology. And by the way, we're going to give you the access to the full report here, but I think that we've put it or are putting it in the community forum. But these are the themes that were there. And you can imagine lack of awareness, knowledge, and training, huge barrier for older adults and their caregivers. People just do not know much about assistive technology until they need it. And then they don't know, some of them don't know where to go to find it. They need help with those resources. Where do I go? Where do I start? Who do I talk to? Several folks mentioned that seniors and caregivers often find it overwhelming to research the thousands of available products. So we may need to be thinking, how do we assist them with that? How do we help them narrow the options? Complex systems, emotional fatigue came up, digital literacy, the whole issue around AI and not understanding it, not being aware of it. Was mentioned that area agency on aging counselors really need training around assistive technology. That may be only a few states or it may be most of the states, but it was mentioned a couple of times in your breakouts. Capacity of the older adult. Things like the cognitive decline over time or feeling like I can't learn something new is a capacity issue for people. Home environment barriers, the emotional fatigue, just adding one more thing I have to learn. Limited support from family and friends falls into that category theme. You know the concerns, fears, attitudes, stigma issue. I know that you do. Privacy concerns, the whole issue around potential scams. People are afraid that they're going to get scammed some way with their technology. I wanted to read you a comment that was put on the Padlet here about Mrs. Guthrie, Nancy Guthrie. So one of the items mentioned was not having appropriate training to spot AI or other types of scams, and that causes fear in trusting technology. In addition, with the current pending case around Mrs. Guthrie, fear that even if they use the technology, even if they have it and they use it, that may not keep them safe. And is it really worth the cost or the hassle? Because criminals know how to get around these things. You can imagine that there are people thinking that right now after that case got so much press. Stigma, it's not just the stigma of having a disability, but it's also if my assistive technology looks medical or it's visible, that creates some stigma in some people's minds about using assistive technology. Geography. You can imagine some of these, but you all put things like access to transportation, access to the internet in some rural areas, a huge issue, affordability of internet service, availability of assistive technology if I'm in certain geographic areas, et cetera. Transportation, we talked about this. Someone put it's a need, a barrier is transportation to the demo center. Like I can't even get there to find out about the AT. Connectivity, we talked about this, lack of internet and broadband in some areas. Cost, again, the cost of internet service is a barrier for some people. And a lot of AT is internet or Wi-Fi dependent. So that becomes challenging for people who also have these internet and broadband issues. Inappropriate or inadequate referral and assistance. I tried to frame this in a way that was broad enough to capture a lot of your input, but things like lack of local trainers to follow up on my use of assistive technology, difficulty finding trusted advice and trials so that I may end up purchasing the wrong equipment, complications with use and no one readily available to help me, not knowing who to ask. Staff knowledge of AT is incomplete. There's a lack of general awareness of AT among some agencies. If you'll go on to the next slide, Ryan. Another barrier, of course, for individual older adults is funding, lack of resources, money, lack of insurance coverage, lack of Medicare or Medicaid coverage for certain types of assistive technology. And then legal barriers. I'm not allowed, a person put, I'm not allowed to go to their home to help them. So that's some barrier in some agency. Home environment barriers, maybe rental restrictions, older homes, et cetera, that create these legal and liability concerns. And then miscellaneous, I went ahead and put these in the slide. I couldn't figure out where else I should put them. So some people said assistive technology is too bulky or not comfortable, and that is a barrier for some older adults. Limited support from family and friends to implement and sustain the AT. And how we talk about aging and people with disabilities in a way that everyone feels included and accessible for their individual situation. This was the final comment on that Padlet. And I think we need to be thinking about, how does the way we talk create barriers for older adults to seek this kind of assistance? Okay. I have gone a little bit going over that report. So now I want to set you up for your breakouts. And we have a few questions for you. If you'll go to the next slide, I think. Yes. Okay. So when you get in your breakout room, we're going to ask you to please introduce yourself quickly and the agency you're from. You will be with other states, so you may want to say your state too. Choose a facilitator. There will be members of ATAP will be in the room, so if you want to make them be the facilitator, you certainly can. Select a timekeeper, select a scribe, somebody who is willing to type up the notes for your group. Maybe that person's going to type right now as you're in the breakout, or maybe they're willing to take some handwritten notes and then type up the notes for us. We will have you send those to Marty Exline at his email address, and you'll get that in the follow-up to the meeting. And then finally, you may want to share your email in the chat so that those of you who are together in these breakout rooms, can continue to meet with each other, connect with each other, share ideas. So next slide. Here are the questions we're going to ask you to discuss. And you may want to take a minute or two at the beginning of your breakout to jot a few ideas down in answer to each of these questions. And I say that because sometimes some of us need a little thinking time before the talking begins, right? So honor that, give people a couple minutes to jot down the answers to these questions. And we'll put these in the chat too. But the first one is, as you heard about these collaborations and the states that we highlighted in session 3, which Marty gave you a review today, what caught your attention? What catches your attention? What stands out for you? Just make a few notes. Second question, as you think about the needs and barriers we identified together, which was what I just went over with you, what do you notice? What grabs your attention? What has you think, oh, I need to think about that some more with my partners or back in my home state? And then 3, given these, what does this mean for the work in your state? What's the implication for your state, given what we've talked about in the last few sessions? And the 4th item is, as a group, well, first of all, individually, pick one barrier or challenge that we just went over, and look at what you might do together with other partners to start to address that barrier in your state. So you all know what the barriers are in your state. Let's just pick one. Think about it by yourself individually, write a couple notes down. What would I like to address? Who else might need to be involved? What other partners could I pull in? And just begin to brainstorm about how you might create a new or an expanded collaborative partnership to address the barrier that older adults in your state are experiencing in getting assistive technology. And then we're going to ask you to share that after you write a few notes, share that answer to number 4 with the people in your breakout room. Why? Because they may have some other ideas for you. So as you all share with each other, you can use each other as a resource on that question. Okay,
Hey,
we're going to
Andrea,
do this. Yeah, Jeannie.
how long do you want to stay in your groups?
Yeah, because I used too much time and I apologize. So I was going to have us do this for 40 minutes. I think we need to do this for, what if we do this for 25 minutes? We'll skip the large group discussion. We'll do this for 25 minutes. So we will be back together at 10 till 1, 2, 3, 4, 5. Yeah, 10 till the hour. We'll try to make that work. And then Marty has a couple of announcements that we need to make, and we should close. How does that sound?
Sounds good. I'm sorry. Just tell me then I was trying to fix the rooms. How long was it?
Let's be in the room for 25 minutes.
Sounds great. Thank you so much.
Well, thank you. Yeah, 25 minutes. And we may go a little bit over, Jeannie, and that's okay.
Okay,
But I want to give Marty enough time to do his announcements at the end.
Okay, and I will give you a 5-minute warning, okay?
Great, perfect.
If I remember how to do that.
These questions, those of you who are moderators, those of you from ATAP, you may want to put these questions in the chat. I don't know how we can access them. if we don't do that. So,
Okay.
Yeah, I think we'll have 3 groups with ATAP moderators.
okay, and the other groups don't, but perhaps I could jump into the other groups,
Hmm.
or Jeannie could, and maybe Jeannie can because she's the host, and put those questions in. So I
I
don't
may
think,
be able to do that. Yes, I may be able to do that.
right. Okay, thank you.
All right,
All
I'm gonna
right.
pop y'all in.
All right, sounds good. Moderators, hope you can remember the questions. Shoot.
I was in mid-sentence as well.
Yeah, we had a participant in mid-sentence.
Oh, darn.
Okay,
Oh,
so I think everyone's coming back. So perhaps we could take a couple of comments because Marty, don't you just need 5 minutes to wrap it
Yeah,
up?
yeah, I don't think I
Okay.
even need that long. So yeah, that'd be
If
great.
if you were in mid-sentence in your breakout room and had something to contribute, raise your electronic hand. That would be awesome. Tammy, I know you were because you were in my room. Do you want to finish your sentence? What barrier you were picking? There's Tammy.
you are unmuted.
I was saying that I was picking, someone else in our group had talked about how you feel like you're always doing public awareness things. And then, in my case, I don't think a month goes by that somebody doesn't say, "Oh, you're such a great resource. I had no idea you were here." And it's like, okay, how can I make that so I don't hear that every month of, you know, that type of thing?
Mm.
Beautiful. Beautiful. And we're going to talk some more about that next session. So the awareness piece is going to get a little deep dive in our next session. Anyone else Tammy, thank you. Anyone else who was mid-sentence or have a burning comment that you'd like to share with the group? Okay. I did, yes, I don't know about all of you, but in my group, we didn't get our emails to each other. We were supposed to share that. So if you were in my group or another group that didn't share emails, put it in the chat now and we'll try to get that out to each group. If you'd like to share your email address, then stay in touch with your group. Thank you, Christina, for reminding me. And I want to apologize to everybody that I went a little long on that report review, which cut into our time. But we will do some more breakout group work. So don't have no fear. We will get back to it. I'm really appreciating that you all are participating in those breakouts and sharing ideas and concerns. That's what the learning community is about, right? So thank you. Um, all right, I'm looking at the chat. Most of this is email addresses. Thank you, everyone. And thank you to the scribes who took notes. What we're going to ask you to do again is send your notes to Marty Exline at his email address, which, Marty, will you put it in the chat again, please?
Yes.
Or I can. No, I can't. You'll do it faster. Um, okay, before I go to Marty with his announcements, Jeannie, anything that you need to share with the whole group?
Um, I don't know if Marty's, you're going to say this, but there is a survey at the end that will show up once we close out. If you would please fill that out, that would be fantastical. That's it. And thank you, thank you, thank you.
Great.
And thank you
Great.
for bearing with me if you got lost and didn't get into a group and had to go out and come back in. And thank you.
Thank
It's an
you.
experience.
It is technology. All right, Marty, shall we go to you for our announcements then?
Yeah, if you do have one of the things, if you do have, hopefully you've seen the AT community. If you do have any documents, like anything, any type of assessments or documents, that's one thing we talked about in our group was, if you have an agreement with an area agency on aging, then, would you share those with people? So that's one of the things we talked about. Um, so just any documents, feel free to email them to me and we can put them in the community forum or just put them in there directly. Um, and I think Jeannie mentioned, please complete the survey that'll pop up once you leave. And next session, session 5, will be on May 13th, again from 3 o'clock to 4:30 Eastern. And it's going to be on awareness, assistive technology, know it before you need it. And that came up in our group again, you think you do all these presentations and everything, and you still have all the folks that say, I just never heard about your group, and this is great, this is fantastic. So that's kind of going to be the focus for the session on May 13th.
Very good. Thank you. And again, we're going to complete with the survey, post survey. So please remember to fill that out. I want to say thank you to everyone who participated today. I heard good conversations going on and a lot of sharing, and that's what this is about. So thank you, thank you. And thank you to ATAP for bringing us all together for this important work. So we will see you in May. Please have a good evening. And any questions or concerns, you can reach out to us and we will try to address them.
All right. Thank you very
All right.
much. We're closing out.
Thanks,
Thank
everyone.
you.